It's we're exactly 2 weeks from my admission to Memorial Sloan Kettering Cancer Center for my clinical study that I'm going to be doing, which is going to be a depleted T cell allogeneic stem cell transplant. That is a transplant that comes from stem cells that come from a donor. It's basically a bone marrow transplant, and it's happening in 2 weeks. And rather than get into the specifics of what the transplant does, just wanted to talk a little bit about what I'm worried about. And sorry, that's the dog in the background. Theta, come here. Anyway, so there's a danger to doing these transplants, and there is a mortality rate, and there is a danger, and it's hard to think about sometimes when you're going through it, because I'm still young. I'm still 37 years old, and I'm not excited about the prospect of potentially dying, but the chances are pretty small that that's going to happen. There's an 85% chance that I'm going to make it through the transplant just fine in the first year, and those are pretty good odds, but there's still that small bit that's in the back of your head, that you think about, and it can be very scary. And when you're someone like me and you think about what you've done in your life, I just don't feel like I've done everything I wanted to do in life. So that eats at me even more, and I don't mean to sound like a big baby, but I think that if I wasn't nervous, like my mother says, if I wasn't nervous, I wouldn't be human. If there wasn't a little bit of worry in me, then I wouldn't have a heart. So I'm definitely nervous, but I definitely think I'm strong enough to get through it. I mean, I feel strong enough. As you may know, I'm recovering from an auto transplant because they had to do the first transplant to get the cancer down to a level that was low enough to be able to do this bone marrow from a donor transplant. So I will get into the specifics of how that works in my next video, but I'm trying to keep these fairly short so that you don't have to sit in front of the computer for too long and watch my ugly mug. You can see my hair's actually coming back. Look at this. My hair is coming back, and I just had to shave. My facial hair has been going like crazy. But I'm definitely feeling stronger. I haven't vomited in 7 days, which is a record. So I think I'm past the vomiting. But we did have to do the first transplant to get the cancer down to a level where we can be successful with the second transplant. And so now we're going to go in and try to knock this thing out. But the thing that keeps me up at night, quite literally, is trying to put that small chance that something bad happens away, and try to lock it away, and use it as motivation. It's kind of hard to do when it's you whose life you're thinking about, but it needs to be done. And I've gotten a lot of good support and a lot of kind words from the people out there who watch my videos, and maybe you have something encouraging to tell me now. But the countdown is on. It's 2 weeks, and we're in final preparations, and I'm just trying to get through it. So I will be back on doing another video in a couple days to talk about some of the logistics and how the things work scientifically and medically. And I also have to go in for a bunch of pre-op testing, so I will talk a little bit about that as well. Anyway, thanks again, and talk to you soon.